Hey guys, Dr. St. Jean here at Unity Chiropractic Center in Lincoln Park, Chicago. Today's talk is video 2 in our Eliminating Carpal Tunnel Naturally video series. It's kind of a mouthful, but what I'm basically saying is non-drug, non-surgical approach to carpal tunnel. So in this video, we're going to discuss some of the root causes, some of the risk factors, and some of the associated medical conditions with carpal tunnel syndrome. Feel free to check below the video after you're done to click the link for the rest of the video series. It's really important to note that the cause of damage to the median nerve in the actual carpal tunnel is subject to a lot of debate. There's a lot of different thoughts as to what's going on here. But one thing that all camps can kind of agree on is that there's an abnormally high amount of pressure in the actual carpal tunnel, and this pressure is what becomes the main problem. It seems like the pressure starts to obstruct venous flow, so blood flowing out of the hand, and that causes edema buildup and then eventually ischemia to the actual nerve, the median nerve in this case, which is lack of blood supply. Not good. So carpal tunnel syndrome is associated with a ton of different various risk factors, all of which you really want to consider when you're trying to create and cultivate an effective treatment program, right? You can't leave some of these things out. So you want to know, is a risk factor like increasing age something we need to consider, increased BMI, female gender, lack of exercise, pregnancy, breastfeeding, just to name a few. Some of these things we can do something about. Some of them we can't. You can't change that you're female, but we definitely can change your BMI. So that's where it becomes relevant in terms of treatment. Interestingly enough, genetics actually play a role too, and a lot of people don't think about genetics as a component in carpal tunnel. It's usually overlooked. But when I say genetic, I mean there's a strong familial susceptibility that's probably more so related to multiple inherited characteristics that puts the particular individual at greater risk for carpal tunnel. So things like a square wrist, or a thickened transverse ligament, or short stature, to name a few. These seem to cause carpal tunnel in more patients and cause problems in those patients. This is something that you definitely can't miss when you're doing the exam and history. You've got to take these into consideration because then treatment won't be as effective. There's also other inherited medical conditions that can be associated with carpal tunnel, things like diabetes, thyroid disease, usually in this case hypothyroid, and then even certain neuropathies. So you got to consider genetics. That's another thing to consider. Certain medical conditions, pre-existing medical conditions, can also lead to carpal tunnel syndrome. So that's important. You can't just start treating carpal tunnel and then they have all these other things you're not considering. Something that's more obvious is a wrist fracture, pretty straightforward. A flexion extension injury, a very severe one, can cause problems with the median nerve. Space occupying lesions, that's a little bit more of a scary one, but nonetheless needs to be considered because it can cause carpal tunnel. Something pushing in and compressing on that nerve is going to create these types of symptoms. Then of course some of the more common ones that we most of us are aware of, right? Diabetes we know is associated with carpal tunnel, hypothyroidism like I said, whether inherited or not. Rheumatoid arthritis is another big one, and then menopause. Don't forget about menopause. These can all cause carpal tunnel syndrome. There's also lifestyle factors, or if we want to get fancy with semantics, we can say vocational factors, right? That we need to consider as well. What's the person doing? What are they doing at work? What are they doing at home? What's their environment like? Any environment that's going to increase or propagate pressure or compression of the median nerve in that carpal tunnel is going to cause a problem. So activities that involve consistent force through the wrist, or high amounts of repetitive movements like typing or hammering, exposure to excessive vibration can be a problem. I think about this almost every morning when I leave my house because there's a bunch of construction going on in our garage. We live at a big high-rise and there's a construction going on in the garage there, and these guys are sitting there drilling and there's so much vibration going through their body that can cause carpal tunnel. Also, exposure to excessive cold seems to be a problem, which is kind of interesting. The last point I want to make about causes of carpal tunnel is an area that is less known. A lot of people miss this, but these are definite root causes that should be considered. And when they're not considered, it's really unfortunate because the patient doesn't really respond to treatment. So typically certain nutrients are necessary for the health of your nerve cells. And there's also certain nutrients that help combat inflammation, reduce inflammation. So the depletion of these nutrients is multifactorial. There's a bunch of reasons why this could happen, but it can be implicated in carpal tunnel. And the reasons why they could be deficient is that maybe you're just not eating enough of them, right? Maybe you're not getting them in your diet. Or maybe it's something a little bit more complex, like food sensitivities, GI infections, gut dysbiosis, all those different things that disrupt the digestion and the absorption of those important nutrients. Heavy metal toxicity is another common problem that's observed in patients with carpal tunnel and not really thought about. These heavy metals make it really difficult for your body to utilize these important nutrients for the nerve cells. And that can, again, obviously impact your ability to heal these damaged nerves. So specifically the median nerve. So we'll get more into the specifics of this information in the next few videos. I have a whole video coming up on nutrition and supplementation for carpal tunnel, so definitely tune in for that. But feel free to click again below the video to get access to more awesome information regarding carpal tunnel treatment in a non-surgical, non-drug way. If you're ready to take the next step and you want to schedule a one-on-one session here with us at Unity Chiropractic Center in Lincoln Park, Chicago, go ahead and click the link below to access the scheduler for our website. This is Dr. St. Jean. I hope you found this information helpful and useful. Be well. See you next time.